Assalamualaikum and hi everyone. My name is Hanis Murni binti Muhammad Yamin and I'm from Bachelor of Physiotherapy Cohort 21. For Pathology subject, I will talk about Haemophilia. These are the contents that I will talk in this video. The first one is what is Haemophilia? Second, types of Haemophilia. Third, Haemophilia genetic inheritance, signs and symptoms, normal clotting mechanism, pathology of haemophilia, diagnosis and laboratory blood tests, severity of haemophilia, and treatments. First thing first, what is haemophilia? Haemophilia is a disorder in which blood does not clot normally because of insufficient blood clotting factors. Person with haemophilia bleed for a longer time than a normal person would. Bleeding may occur spontaneously without a known cause or after an injury. Types of haemophilia. Haemophilia A or classic haemophilia. This is because of clotting factor 8 deficiency. It is most common type of haemophilia. It occurs in about 1 in 5,000 male births. Next, hemophilia B or Christmas disease. It is because of clotting factor 9 deficiency and it is the second most common type of hemophilia. It occurs in about 1 in 25,000 male births. Next, hemophilia genetic inheritance. Hemophilia is a genetic disease. It occurs when the gene that makes factor 8 and factor 9 is mutated. The faulty or mutated gene is located on the X chromosome, therefore it is one of the X-linked diseases. Commonly, sons will get hemophilia while daughter will be the carrier of hemophilia. In some rare cases, hemophilia is caused by spontaneous mutation. As you can see here, this is the affected father. He has hemophilia and at the X chromosome there is mutated gene while the mother is normal. So the offspring produced are normal sons and the daughters will be the carrier of hemophilia. Next, this is the carrier mother, carrier of hemophilia, and the father is unaffected. So in this chromosome there is mutated gene. So the offspring produced are son, affected sons. The son will get the hemophilia and one of the daughters will be the carrier and another pair of offspring will be normal. Next, signs and symptoms. Person with hemophilia will easily bruise and external bleeding and internal bleeding occur. Examples of external bleeding are bleeding in the mouth from a cut or bite or losing a tooth, nosebleed for no obvious reason, heavy bleeding from a minor cut. Examples for internal bleeding: blood in the urine from bleeding in the kidneys or bladder, blood in the stool from bleeding in the intestines or stomach, bleeding in the joints, bleeding in the brain, and bleeding in the soft tissues. Bleeding in the joint. Bleeding in the knees, elbow, or other joints. It will cause tightness in the joint with no real pain and visible signs of bleeding. Joints will become swollen, hard to touch, and painful to bend. Bleeding in the brain. Patient will experience painful headache or neck pain or stiffness. Other than that, double vision and seizures. Bleeding in the muscle. Bleeding in hip muscles, forearm, and calf. It will cause severe blood loss, risk of unstable blood pressure, and limit the movements. Next, normal clotting mechanism. Injury to blood vessels results in bleeding, then vessel constrict or vasoconstriction and clotting factors are activated. Then, along with other substances, clotting factor cause strong platelet plug to form. Then, a stable fibrin clot forms over the platelet plug as a final seal on the injury. Then, the bleeding will stop. While the pathology of hemophilia, injury to blood vessels results in bleeding. Then, vasoconstriction and clotting factors are activated, but due to the lack of clotting factors, factor 8 or factor 9 will cause a weak platelet plug to form. Incomplete or delayed fibrin clot will form, and non-effective blood clotting mechanism allows bleeding to continue. You can see here the injury to blood vessel results in bleeding. Then the vessel constrict and clotting factors are activated. For normal, natural clotting factor helps form a strong platelet plug, and a stable fibrin mesh forms a seal clot over the platelet plug to stop the bleeding. While person with hemophilia, due to the lack of natural clotting factors, means only a weak platelet plug can form. Then, incomplete fibrin mesh allow bleeding continue. Diagnosis: personal history of bleeding, family history of bleeding, and the inheritance pattern of those affected. Laboratory blood testing. These are the examples of laboratory blood tests. Prothrombin time to measure how quickly blood clots. Activated partial thromboplastin time (APTT). Platelet count to measure level of platelet present in the blood. Factor 8 and factor 9 assays to confirm the deficiency of coagulation factors. Oh, there's some typo here. This is factor 8, not factor 7. I'm sorry about that. Next, severity of hemophilia. There's few types of severity of hemophilia. The first one is mild. The factor level are above 5% to 40% of normal. The bleeding episode is severe bleed with trauma or surgery. Spontaneous bleeding is rare. While for moderate, the factor level is between 1% to 5% of normal. Prolonged bleeding with minor trauma or surgery, occasional spontaneous bleeding, which means spontaneous bleeding will occur. And lastly, severe, below than 1% of normal, spontaneous bleeding into muscles or joint. For your information, normal is 50% to 150% of factor level. Normal blood coagulation. Lastly, the treatment. Treatment with replacement therapy. The main treatment for hemophilia is called replacement therapy. Concentrates of clotting factor 8 for hemophilia A or clotting factor 9 for hemophilia B are slowly dripped or injected into a vein. Desmopressin. It is a man-made hormone used to treat people who have mild hemophilia A, antifibrinolytic medicines. It helps to keep blood clots from breaking down. These treatments use medicine, while another treatment is rehabilitation. The PRICE protocol in case of acute bleeding. PRICE is PRICE stands for protection, rest, ice compression, elevation. PRICE is a treatment many healthcare professionals recommend for joint bleeds. It also reduces swelling and tissue damage when used together with clotting factor concentrates. And person with hemophilia can do exercises regularly prescribed by the physical therapist or physiotherapist. And that's all. These are the reference. Um, yeah, that's all from me. Thank you, and I hope you enjoy this video. So stay safe, everyone.